This is the best of the Rotary E-Club of Silicon Valley, where we select from our library of hundreds of past presentations. One of our goals is to connect with people who have wonderfully interesting stories that inspire us to think about solutions to vexing problems in all sorts of ways. We hope you will find inspiration in what you hear today.
We had volunteers that went through every single hospital in the country, over 8,000 hospitals, researched, pulled out the financial assistance info, put it into a web tool. And now a patient can go to our website, put in their household size, their income, what hospital holds the debt, and then we will do the rest. We fill out all the paperwork. We submit the paperwork on their behalf. We advocate on their behalf. Millions and millions of people are on payment plans or declaring bankruptcy that they don't have to pay because they have no idea that these programs exist. Everybody listening knows someone that has gone through a medical crisis, and having the knowledge of what these programs are and how to access them can change the lives of people around you, your friends, your family, your community.
We're excited to have Jared with us today, and I am really jazzed to have connected with him to learn about the things that he's doing as a part of $4. Quick summary. 10 years ago and change, he decided that he was going to make the world a better place. And that story of how he does that is one that I hope will be as inspiring to you as it was to me. And with a lot of enthusiasm, I hand the mic over to you, Jared. Thank you for being with us.
Thank you so much for having me. Yeah, really appreciate all your time. I'll dive right in. $4, we're a nonprofit organization. We crush medical bills. This all kind of came about in 2012. My wife and I were sitting at home. She got a phone call and her aunt had passed away from cancer. A few minutes later, I got a phone call and my cousin had gone into labor 7 weeks premature. Baby needed heart surgery to live. And the family was running around and talking about how are we going to pay for it? And that frustrated me a lot. It was kind of my first run in with the healthcare system and the realization of when you have a medical crisis, you usually have a financial crisis that follows. And that was something that I wanted to help people avoid if I could. And so I hopped online and came across a few stats. Number one cause of bankruptcy in America, 1 in 3 Americans just avoid care because they can't afford it. And there is a total $195 billion in medical debt in America right now, which is pretty wild. So I wanted to help people. And I started crowdfunding. I started crowdfunding in Portland, Oregon. $1 for Portland was actually what it was called. And it was finding people in our community and getting people to sign up for small, recurring monthly donations. Every month we pool the money together and pay medical bills for people in our community. And we started at coffee shops, breweries, music venues, and it was just a very grassroots community effort. And, we helped families over the years through our, Dollars Add Up program. And it was a lot of fun. And I was at a networking event and I met an attorney and he asked me, hey, have you ever heard of charity care, financial assistance, 501R? And I had no idea what he was talking about. So he was, saying, hey, there are these programs where the hospitals will actually waive your medical bills if you are within a certain income range, usually at or below 300% of the federal poverty guideline. And I had no idea that was a thing, but I felt like a chump because I had been paying medical bills for low-income families that all would have been eligible for free or reduced care if I would have known about these programs. So I switched the model. In 2019, I started finding people that had medical bills and started digging into these policies. I launched the debt forgiveness program. So it is true. When the Affordable Care Act passed, it required nonprofit hospitals, which is most in America, to have charity care and financial assistance policies. So this is, if you are within a certain income range, the hospitals have to waive your medical bills, or sometimes it's a sliding scale based off income. So you can get the entire amount waived or pretty heavily reduced. I started looking into it, and in the first few months, I got over $1 million in medical bills to disappear for people. And I was thinking, oh gosh, this is something. And how do I look this up more and dig into some more of these policies. And the reality is like, and this is, is one of those things that is just so frustrating. But yeah, millions and millions of people are on payment plans or declaring bankruptcy that they don't have to pay because they have no idea that these programs exist. And when I found that out, I was shouting from the rooftops trying to tell people, what is charity care? How do you access? Every single hospital has their own policy, their own application, their own, and it's tough to find and it's tough to navigate. And then when you do navigate it and you submit it, through fax, which is what most hospitals require you to do, they kind of call all the shots and there's not really a whole lot of accountability in this space. So I was trying to spread the word, to tell people what this was, and I wasn't super successful. And it was really frustrating. It's like, well, why is nobody talking about this? So my little sister recommended that I get on TikTok. So I hopped on TikTok and I made a 60-second video that told people what charity care was. So I came across this Stitch, if you're familiar with TikTok, which I was not at the time. So it was a video. It said, what is a piece of information that you learned that feels illegal to know? And I stitched my video onto that. Just said, hey, this is what charity care is. It's how you access it. And if you need help, you can shoot me a message. I'll help you out. I'm expecting 50 people to see this video. Maybe the video just blew up. Been seen over 30, 40 million times. It is, it was a wild few weeks. And actually, what's kind of fun is today is the 2-year anniversary of that video going viral. So that was, a crazy time. And at that moment, $4 was just me. I was running around trying to, figure this out. And people were tens of thousands of messages coming in. People asking, can you help me? I've got medical bills at this hospital, and I was just helping people in the Pacific Northwest at the time. So this, like, overnight, this turns into a national organization. And we have got, I think in the first, it was over $100 million of medical bills submitted to us, people asking for help. And we needed a way, to quickly see if someone was eligible or not, which we didn't have at the time. So I put out a call to volunteers and said, hey, we need some help. And we got some phenomenal people that created a eligibility screener. So we had volunteers that went through every single hospital in the country, over 8,000 hospitals, researched, read the policies, pulled out the financial assistance info, put it into a web tool. And now a patient can go to our website, put in their household size, their income, what hospital holds the debt, and then we will do the rest. We fill out all the paperwork. We submit the paperwork on their behalf. We advocate on their behalf. We call the hospital. We pester them to make sure that they're doing what they're supposed to. And then we have, phone support, text support. And yeah, so that is what we're doing day to day. We have a team now of about 12. We've got people that are patient advocates full time that are doing this. And if you submit, through the eligibility screener, you'll be connected to a patient advocate if you're eligible, and we'll walk you through the process. So when we launched this eligibility screener in the first month, it was like $250 million of medical bills submitted to that screener. People saying, hey, I've got a medical bill. Can you help me? And obviously not everybody's eligible. We can get into the details of what these policies look like. But since this video, we've been able to eliminate over 20 million of close to $25 million in medical bills for people all over the country. And that's just the ones we know of, because sometimes we submit paperwork and we don't hear back from the patient that the medical bills are gone. And we've been able to turn every dollar donated into a little over $50 of medical debt relief, which is wonderful. And our plan now is, obviously we're a patient advocate organization. We help patients through this process. We are, trying to add clarity into a really difficult process. And the bigger vision here is that we can make charity care known, easy, and fair. So I feel like we're trying to do our best through social media partnerships, SEO and Google ads and all that, to try and get the word out about this program. And then making it easy by creating, automations and creating the eligibility screener, keeping our database up to date and then fair, as in we believe that through patient advocacy, we can actually drive policy change at the hospital level, which we've been doing. So because we have so much data, so many patients are coming to us asking for help, we can look and notice trends. So, maybe we have a dozen patients in a particular hospital that are, might not be living up to their policies. We can approach that hospital and say, hey, we've noticed a few things and we'd like to chat. And that's been super effective. And we've gotten hospitals to retrain staff, change policies, have board meetings about this work and try to make their policies more known to their community as well. So that's kind of what we're doing, what we're trying to do long term. And yeah, it works. We get messages like this every single day. People saying, hey, I saw your video, followed the steps, or you helped me, because we do have a self-advocacy track where if the patient wants to kind of take the info and run, we have all of our instructional videos and kind of encouragement that we can give, and they can fill out the paperwork themselves to try to empower patients to do this. So that is $4. That is what we do. There's a few ways to get involved: volunteer, donate, partner. Most of the patients that come through that need help are through social media. And that's great. We've been able to ride the social media wave and it's been great, but maybe the people that need our help the most, they might not be on TikTok. And we need to figure out how to plug into like-minded organizations that are helping people that are, kind of in that similar population, low income. We get a lot of referrals. So other organizations that are serving a similar population that can send patients to us is another way we would love to serve people to get plugged into the right communities. So thank you so much. And yeah, we can go to questions.
Awesome, Jared. Great.
Here are some highlights from the question and answer session.
What are the kinds of things that typically get in the way of someone being eligible?
Yeah, so typically it is income. So it would be 300% of the federal poverty guideline. That would be for a single, that's right around like $40,000 a year gross annual income. And for a family of 4, that might be closer to like 85,000. And so if you make over that amount, then there's kind of 2 options. One, you're just not eligible, or maybe there is a discount. So it's like, well, if you have any type of insurance, you can only get X amount. But I mean, we are primarily working with people that are uninsured and underinsured. And when you have insurance, but your deductible is $8,000 and that bill comes in, like that should be eligible for charity care as well. And we fight those all the time and are successful. You shouldn't be able to single out people that have insurance or not. Same with like minimum bill amounts. Some hospitals say, well, if your bill isn't $2,500 or more, then you don't get charity care. Can't do that. But again, they do it all the time. We're a nonprofit. We have been able to survive off philanthropy and the generosity of individuals. We do have a lot of small recurring monthly donors that have stuck around from our early days at Dollar for Portland. We have some large donors that give, and then we have, as we've been growing and gaining credibility, we've had a handful of foundations and groups that reach out, say, hey, can we help? I mentioned some accelerators that we've been a part of. So yeah, we're definitely, still a very small organization trying to scale. There's obviously no lack of need. So, we can keep going. I feel like we're just getting started, but so far it has been through the generosity of individuals.
And when we look at something like this, I remember you telling the story about $4 to begin with, and I'd like you to share that with the group. So getting recurring monthly payments of $1. How you went about that, I thought was a pretty good story that might inspire some people to think about projects in their own communities. Could you tell that?
Yeah, how we got those individual dollars. So we started in Portland. Portland is food, beer, coffee kind of town, and weed. Those are the things that Portland's known for the most. And I would go into bars and breweries, coffee shops, and I would say, hey, if somebody signs up for a small donation, will you give them a free beer, or will you give them a free coffee, or get into the concert? So I would just go around and talk to these small businesses, and they would let me in and give away free stuff for people that would donate. So we kind of created this community of people through like the food and brewery coffee scene in Portland. It was a lot of fun, early on. So that's how we slowly built our giving community.
So a couple of questions that came in about the law related to this. So this came through with the Affordable Care Act, I believe, right?
Yep.
And so are there any ramifications for a hospital of not using funds as directed by the law to reduce or eliminate the medical bills of low-income patients? So if a hospital is making it really, really difficult to figure out how to do this, can they suffer for that in some way?
So I think that, like, in theory, yes, right. But I think that a hospital has never lost its nonprofit status because they weren't offering charity care. So the whole idea of this, so Section 501(r)(4) is all about charity care in the Affordable Care Act, and it is hospitals they get billions of dollars in tax breaks for being nonprofit. There's tremendous benefits for them being nonprofit. And in order for them to keep that status, they're supposed to be providing community benefit. And community benefit is defined by what one of the main factors is: free care to people that can't afford it. So a hospital might make a policy that says, we will waive 100% of your medical bills if you're at or below 300% of the federal poverty guideline. And then we have a sliding scale discount from 300 to 400%, let's say. And that's pretty much all that is required by law. And they're supposed to be screening people for these programs, but how do you screen? Some hospitals say, well, we put up a poster in the ER. Well, when you're in the ER, you're usually not reading posters on the wall, your care. Or, hey, we put it on the back of every single bill. We have a phone number that you can call. So hospitals kind of use that as, oh, well, we're doing all we can. What else could we possibly do? And there's a lot that they could be doing that would be more effective. So there really isn't a whole lot of accountability in this space. We go to hospitals all the time and say, hey, you're not doing what you're supposed to do, and we'd love to help you with that. And they're, it's very much like, we are doing all we can. The cases you presented are kind of one-offs, and and then when we give them other ideas of how to make it better for patients, their response is usually, well, word gets out and you don't want to be known as the most generous hospital. So it's a very interesting narrative that we hear from the hospitals. And again, they're able to, they can make these things difficult because there is no charity care police. I mean, one really brief example is about 95% of all hospitals in America require you to fax your financial assistance paperwork in. So who has a fax machine? You know what I mean? So it's that's just one barrier that a lot of these hospitals throw up, and, say, hey, well, this is how you submit the paperwork. And you can try and tell them, well, that, it's a huge barrier for people. You should have an online portal, or you should do that. They don't seem to be super interested in that.
We'll wind things down for today, but just a quick note to everyone watching this recording. We're recording this on Martin Luther King Jr. Day. This is a day where in the United States, we celebrate the best of who we can be. And without a doubt, Jared, bringing your heart and enthusiasm to making this work has made a difference in the lives of so many, and very much in the spirit of not just the day, but of Rotary every day of the year for sure. So in a minute, I'll hand it back to you for a final word, but let's do the standard wind down. We thank you for joining us and for helping us share the stories of those who seek to improve their communities, locally, globally, and digitally. We are part of Rotary International, 1.4 million Rotarians and Rotaractors in tens of thousands of clubs around the world. Our club is both online and always available, so you can attend one of our meetings at any time by choosing the link on our homepage, which you can find at rotary.cool. In our meetings archive, you can find the full recordings, including the Q&A between the speakers and participating members and guests. If you are interested in joining Rotary, are a former Rotarian looking to get back into the organization, or simply interested in how you might make a difference in the lives of others, take a look at the Join page on our site or at rotary.org. You can also find these links in the podcast show notes. So with that, we appreciate that you're being part of this today. And as we like to do, we hand it back to our speaker for the final word. So what would you like for people to be thinking about as they walk away from the recording?
I would say that everybody listening knows someone, or maybe you are that someone that has gone through a medical crisis, and this info can be life-changing. And whether you ever need to use it personally or not, having the knowledge of what these programs are and how to access them can change the lives of people around you, your friends, your family, your community. We've been able to turn every dollar donated into a little over $50 in medical debt relief. So check it out.
Service above self. Thank you very much. And everyone, we will see you next week.
Please help us spread the word about this podcast on social media. Links to our social media posts about this episode, which you can simply like and repost, are in the podcast notes. This only takes a minute, and it helps other people find this story. People who might avoid a bankruptcy by using $4. Additionally, links to $4 and their services, which are free, are in the podcast notes. And if you know someone who might benefit from hearing this show, please email or text them a link or screenshot of this episode. For more inspiring stories, follow this podcast on Spotify or on other major podcast providers.